ہائی ایوری ون، گڈ آفٹرنون اینڈ السلام علیکم. ناظرین، آپ دیکھ رہے ہیں پروگرام پرسپیکٹیو نقطۂ نظر اویس اقبال کے ساتھ GEO TV پر. آپ کو خوش آمدید کہتے ہیں. آج کے اس شو میں ہمارے دو مقاصد ہیں. پہلا، اونٹاریو جو کینیڈا کا سب سے بڑا صوبہ اکانومی کے حوالے سے، پاپولیشن کے حوالے سے، اس کا $186 بلین کا بجٹ پچھلے ہفتے منسٹر پیٹر نے 24 مارچ کو پیش کیا. ایک تو ہم اس حوالے سے بات کریں گے اس بجٹ میں آپ کے لیے میرے لیے کیا ہے اور اکانومی کے حوالے سے حکومت کے کیا خاص اقدامات ہیں. بہت سارے ٹاپ آف مائنڈ سوالات آپ کے بھی ہوں گے. ہم نے سوچا کہ آپ کی زبان میں ان کو ایڈریس کرنے کی ہم کوشش کریں. اور دوسری جانب میں اور آپ پریشان ہیں کہ COVID-19 کی پینڈیمک کی جو ویو 3 ہے، روزانہ کی بنیاد پہ اونٹاریو میں نمبرز جو ہے وہ اوپر جا رہے ہیں، اور جب یہ شو ایئر ہوگا تو ہو سکتا ہے کہ ہم دوبارہ لاک ڈاؤن کی صورتحال میں ہوں، جیسے کہ پریمیئر آف اونٹاریو ڈگ فورڈ صاحب نے کہا چند دنوں پہلے کہ پروونس وائڈ لاک ڈاؤن از اسٹل آن دا ٹیبل. دیکھنا یہ ہے کہ آخر یہ آنکھ مچولی کا سلسلہ کب ختم ہوگا. ان دو ٹاپکس پہ بات کرنے کے لیے آج میرے ساتھ اسٹوڈیو میں موجود ہیں جناب ممبر آف پروونشل پارلیمنٹ فرام مسیساگا ایسٹ کوکسویل، کلید رشید صاحب. آپ کو ویلکم کرتا ہوں شو میں.
السلام علیکم اویس، تھینک یو سو مچ فار ہیونگ می آن یور شو.
اور ناظرین، کلید صاحب تو ہمارے ساتھ اسٹوڈیو میں ہے، لیکن تھوڑی ہی دیر کے اندر ہمیں دونوں پارٹیوں کے ریپرزنٹیٹیوز بھی جوائن کریں گے. لبرل پارٹی سے اسٹیون بلس صاحب ہوں گے، اور NDP پارٹی جو آفیشیل اپوزیشن ہے ان کی جانب سے گررتن سنگھ ہوں گے. اور مزہ تبھی آئے گا کہ جب حکومت اپنی بات کرے گی اور اپوزیشن حکومت کو آئینہ دکھائے گی کہ آپ کا جو بجٹ ہے وہ کس حوالے سے کن کن جگہوں پہ جو ہے وہ ہماری امیدیں پوری کر رہا ہے اور کن جگہوں پہ نہیں کر رہا. کلید صاحب سے بات کرنے سے پہلے میں چاہوں گا کہ جب بجٹ پیش کیا گیا تو کچھ میڈیا آؤٹلیٹس نے بھی ہیڈ لائنز بنائیں، جیسے کہ نیشنل پوسٹ نے کہا کہ $1 بلین کٹ ٹورڈز ایجوکیشن. اس حوالے سے جو ایجوکیشن سیکٹر ہے وہ پریمیئر سے بڑا ناراض ہے. ساتھ ہی ساتھ جو ہے وہ ایک اور میڈیا آؤٹلیٹ نے کہا کہ جو اسپینڈنگ ہے بہت لبرل ہے اینڈ ہیز نو پاتھ ٹو بیلنس. جب ڈگ فورڈ صاحب حکومت انہوں نے سنبھالی تو ان کا ایک نعرہ یہی تھا کہ دے وانٹڈ ٹو بیلنس دا بکس آف اونٹاریو. یہ بھی آج جانیں گے کلید صاحب سے آخر کیا بکس بیلنس ہو پائیں گی. کووڈ کی جو صورتحال تھی اس میں ظاہر ہے بہت ساری اسپینڈنگ گورنمنٹ کی طرف سے کرنی پڑی ہے. Sat, we have Stephen Blias on the phone with us on video. Stephen, welcome to the show.
Thank you very much for having me.
Thank you. And we will shortly have Gurratan Singh as well, representing the NDP party, the official opposition. Kaleed, first of all, I will come to you. What we want to do is, when it comes to the budget, we like to unpack. If you can offer us some summary, very brief to the point, what's so important in this budget of 2021?
Sure, Ovais. So first of all, congratulations on your show, and may God bless you and your family and give you continued success. As you know that Ontario government announced the budget last week. Minister Bethlen Foley, who is the Minister of Finance as well as the President of Treasury Board, announced a $186 billion spending budget. Definitely with this spending budget, we have reached our deficit to about $33 billion approximately, and our total debt now of this province has climbed to $440 billion. But definitely with this budget, the most important thing is, as Premier has said all along, Premier Ford has said all along, that when we have a healthy individuals, we will see a healthy economy. And that is exactly what we are doing in this budget. We are spending billions of dollars on COVID, but not just only on COVID, but on our healthcare sector.
What can you tell the Ontarians in the layman terms? Obviously, these numbers are big, and this big spending is needed to tackle COVID and a bunch of other things. But for ordinary Ontarians, what are the key few things?
The number one thing that I would like Ontarians to know is that we are spending in our hospitals. So we are going to be building a new hospital in Brampton and rebuilding Mississauga, the Trillium Hospital, the M site. We're going to be rebuilding. So we're going to be spending billions of dollars, which means increase in beds and other things. Other than that, the next thing, we are actually giving the grant to our small businesses along with support to families. So as you know that during COVID, we introduced Support for Families program where we were giving each child $200. Now we have doubled that amount to $400.
Let me introduce my third guest tonight, Gurratan Singh from NDP, which is the official opposition in Ontario. Gurratan, welcome to the show.
Thank you so much. Assalamu alaikum to everyone who is viewing today.
And tell us what this budget is good for and what this budget is falling short on.
So let's first talk about where we're at right now. Right now, we're in a situation with an unprecedented pandemic, and people are suffering. Small businesses are suffering. Small businesses, to no fault of their own, are having to close down their shops because they're not getting the support they need. And frankly, from the Conservative government right now, we're not seeing enough support for folks at a time when they're at their worst, where small businesses are shutting down and no fault of their own. We're not seeing enough support for small businesses. When we look at schools right now and our students, we're not seeing support there. We're seeing actually cuts that are being brought into our schools to the tune of over $700 million being cut from our schools at a time where we need to be investing in our schools. Communities like Brampton, the community that I represent, are given false promises of additions to Peel Memorial. Right now, we're a city of over 600,000 people with only one hospital. We're getting false promises that they're going to turn our health center to a hospital, Peel Memorial. But when we look at the budget, there's not a single dollar in the budget towards turning Peel Memorial from a health center into a hospital. There's no money to address Brampton's healthcare crisis. So across the board, we're seeing this budget is really not meeting people where they're at right now. They need support at this desperate time, and we're not getting that kind of support.
This is obviously from the opposition perspective, looks like they're completely unhappy. So is this the case, that what he's saying about the hospital, about the education, about the small businesses?
Ovais, if you look at the budget, it clearly talks about the spending that we are doing in education. Actually, we are spending just over $700 million in education. But also when what Gurratan is talking about the hospital, actually it talks in the budget that there is a hospital coming to Brampton. I mean, their own mayor, Patrick Brown, spoke in front of the media and thanked our government for bringing a hospital, and not only just a hospital, but first ever medical university in Brampton. So overall, the government is spending, and again, if you speak to economists, they will say that this budget is actually a very spending budget, $186 billion. This goes to show you, and this amount has never been spent in the history of our province.
Okay.
So
let me go back
sure.
to Gurratan. So Gurratan, I mean, help us understand so we can read between the lines. I mean, the government is saying they're bringing hospital to Brampton. The people of Brampton are, they should be happy, or there's something that we're missing that they need to know?
So let's just look at the facts. This is not just an opinion that I hold. If you look at global news, CTV News, City News, a lot of mainstream news stations have reported that there's no money in this budget for another hospital, and that there's no timeline given. They've explicitly stated that in their news publications. I'm not saying this alone. This is not a position that I've just made up. This is something that independent third bodies have agreed with. If you read the budget, and I tell people to read the budget, there is literally one line saying they're going to bring an inpatient wing to Peel Memorial. No mention of ER room, no mention of a single dollar, no mention of any timeline. The Premier himself admitted this, Ovais Iqbal, when he came to Brampton. He was called out. This was such a point of contention that the Premier actually had to come to Brampton to clarify his position. When he came to Brampton to clarify his position, he admitted it. He said himself, shovels might be in the ground in 2023. Now, the next election is in 2022. So the Premier is making a false election promise and saying, yeah, we might build something in the next election. That is not what Bramptonians need. We have a healthcare crisis right now. The city of Brampton declared a healthcare crisis before COVID-19. So we need immediate action now in this year's budget. If the Conservative government was serious about fixing Brampton's healthcare crisis, then they would have invested in the budget right now, and they would have addressed this issue by properly funding Brampton Civic, by immediately putting money, dollar figures, shovels in the ground in this year. That's what we want to see. For Peel Memorial to be converted from a health center into a hospital, and a commitment to build a third hospital. We see none of that in the budget. You can read the budget yourself. You will see one line about an inpatient wing for Peel Memorial, nothing else.
Good. So I'll have Kaleed respond to this, but let me pull Stephen into the conversation as well. Stephen, what is your perspective? What is Liberal Party's perspective? Stephen Del Duca's perspective on this budget?
Well, thank you. And it won't surprise you to learn that we are very dissatisfied and unhappy with the budget. Really, Doug Ford and his party have abandoned Ontario families. The budget acts as if we are through the pandemic, that COVID-19 is over, when clearly it's not. There are no new dollars for public health spending in the budget. The budget takes, I think, $1.6 billion out of the education system, on the assumption that COVID-19 will be over by the time school returns in the fall. I think given what the Premier indicated today, it's likely we're going back into some kind of lockdown or enhanced restrictions tomorrow or after the long weekend. And I think it's pretty clear to everyone that we will not be back to normal by September. And to take that money out of the education system when there is so much uncertainty, when there is so much risk, and so much rebuilding that we need to do, is completely irresponsible for our children and for all families across the province.
Viewers, we'll take a quick break, and once we come back from the break, I will get Stephen's perspective, and Gurratan will come back and see, if what Kaleed is saying, if the government of Ontario, what they are saying is how much of that is either true or how much of that is read differently, and what Liberal Party or NDP would have done in these difficult times if they were in the government. So please stay with us.
کینیڈا سرمایہ کاری کے لیے جنت. ٹورنٹو کی گنجان آبادی کے باعث اب آباد کاری دوسرے شہروں میں اوٹوا، برامپٹن، مسیساگا، کنگسٹن اور دیگر شہر اب سرمایہ کاری اور آباد کاری کے لیے آئیڈیل. آپ کمرشل، ریزیڈینشل یا انڈسٹریل پراپرٹی خریدنے یا بیچنے کا ارادہ رکھتے ہو تو ٹیم آف سید کو ایک دفعہ کال لازمی کیجیے. ہم آپ کو بتائیں گے کہ آپ کے سرمایہ کا صحیح استعمال کہاں ہے. لندن، ساؤتھ ایشیا، فار ایسٹ، مڈل ایسٹ، یورپ اور نارتھ امریکہ کی ریئل اسٹیٹ مارکیٹ کا 25 سالہ تجربہ رکھنے والی سید ٹیم کو کال کیجیے 613-276-0398. سید ٹیم، کوسٹ ٹو کوسٹ ریئل اسٹیٹ ود رائل اسٹار ریئل.
This is my masjid, this is your masjid, this is our masjid. I am Kamran Rashid, President of Mississauga Muslim Community Center.
And this masjid, this house of Allah subhanahu wa ta'ala, needs your help. This masjid is a sign of Allah subhanahu wa ta'ala. We learn, we teach the love and the akhlaq of Prophet Muhammad sallallahu alayhi wa alihi wa sallam, not only for this generation, but for the coming generations as well. And so this sign of Allah, this my masjid, this your masjid, needs your help. We need 365 donors to donate $495. That is the running expense of this masjid for one day.
ہمارا اسکول کئی مہینوں تک بند رہا. اس دوران کتنا کچھ بدل گیا. کئیوں کی روزی بند ہو گئی اور ہماری گلیاں سنسان ہو گئیں. ایک دم سے فاصلے بڑھ گئے. ہمارے اسکول جو سونے پڑ گئے. کلاس میں پڑھنے کا بھی اپنا مزہ تھا. دوستوں سے ملے ہوئے بھی جیسے زمانے گزر گئے. کہیں یہ بولتے ہاتھ اپنی زبان نہ بھول جائیں. دل میں یہ ایک ڈر سا بیٹھ گیا. واقعی کتنا کچھ بدل گیا. لاک ڈاؤن اور SOP جیسے نئے الفاظ سیکھ گئے. گھر میں سب مل کر پڑھنے جو لگ گئے. اسکول نہ جا سکے تو اسکول گھر آ گیا. اسی بہانے لیپ ٹاپ بھی تو چلانا سیکھ گئے. ان بدلتے حالات میں بھی کچھ نہ بدلا تو وہ ہے ڈیف ریچ کا ساتھ.
ناظرین بہت شکریہ, بریک کے بعد بھی آپ ہمارے ساتھ رہے. آج ہم بات کر رہے ہیں اونٹاریو جو کینیڈا کا سب سے بڑا صوبہ اکانومی کے حوالے سے, پاپولیشن کے حوالے سے, اس کا بجٹ جو ہے وہ $186 بلین کا کچھ دنوں پہلے فائنانس منسٹر نے ریلیز کیا. اس پہ آج ہم بات کر رہے ہیں. اینڈ وی ٹرائنگ ٹو گیو یو دا پرسپیکٹو, وی ٹرائنگ ٹو گیو یو دا سمرائز انفارمیشن. اینڈ obviously this show is mostly in English, as I have got honorable guest here. I've got Stephen from Liberal Party of Ontario, and I've got Gurratan from NDP, and I have Kaleed Rasheed in the studios. Let's continue our conversation. Before the break we were talking, Stephen, I'll request you, can you please come in and say, Kaleed says your government had more cuts on education versus their government, and they're spending more money and there's no cuts. Is this how people of Ontario should read it? Is there anything that we're missing here?
Well, I think that's a creative interpretation of history, to be perfectly honest. And the fact that Mr. Rasheed needs to go back and try to fight the last election instead of defending his government's budget, which is only a week old, I think tells you exactly the kind of pressure that the government is under. The government is pulling $1.6 billion out of the education system in the fall. They're doing that on the basis that they believe that COVID-19 will no longer be a problem, and therefore school boards and schools will no longer need this additional funding. I think that's absolutely ridiculous. Tomorrow we're going to announce that much of the province is returning to some form of restriction or stricter lockdown. That's what we expect. I don't think anyone should be under the impression that things are going to be hunky-dory and back to normal in the fall. In terms of the hospital in Brampton, Mr. Singh is absolutely correct. There are nice words in the budget. They say we would like to think about doing this, but there's no dollars behind it. Well, I would like to buy a Ferrari, but I don't have the money to buy a Ferrari. And so I'm not going to go and tell my family I'm buying a Ferrari unless I have the money to do it. And that's what Mr. Rasheed and Doug Ford are doing to the fine residents of Brampton. They're promising something that they just haven't been able to deliver. And if you go through the budget, it is riddled with these exact same types of false promises. And the worst part of it all is that there's all these false promises and they're still running record deficits for the next decade. So we're going to have huge deficits and nothing to show for it. That's absolutely backwards.
False promises in politics and false promises, right? I mean, they probably go hand in hand. Maybe I'll request Gurratan. I mean, Gurratan, when we go out and talk in public, with the ordinary Ontarians, one thing that is boggling their mind is, if not everybody have got the vaccination, why we go in lockdown, and then we start opening up schools, we start opening up dining, and then we go back to lockdown? What is the instance of your party, NDP? How would you rule the Ontario in this type of pandemic?
So the reality is this. People are struggling at a time that has never been experienced beforehand. And it's really sad. It's really, it hurts me and everyone to know that people are struggling at a time to no fault of their own. Small businesses are having to shut down, and people are really living in a precarious situation right now. But the reality is we are likely heading into another lockdown. It's because the Conservative government and Doug Ford did not listen to the health experts and provide the supports that people need right now. They didn't heed their calls to slow down earlier openings that the government did. They didn't bring in paid sick days, and we know that in Brampton, for example, workplaces are one of the biggest areas of spread for COVID-19, and they didn't provide supports to people when they needed it the most. And Doug Ford is walking us into another preventable, something that could have been prevented, this oncoming lockdown, but because he didn't want to spend the money to support people at a time where they needed it the most, these are the repercussions of that. And it just really makes me think of those small business owners who are going to be struggling and maybe shutting down permanently because they've not been given the support needed from this current Conservative government, who continually sides with big box businesses like Walmarts and supports Amazon over small businesses and mom and pop shops. We also know that areas that should be the focus of vaccinations, like Brampton and Peel, have been left behind by this government. They have not actually prioritized us. And it's very clear. You can hear about this pilot project the government rolled out where they provided vaccines to 325 pharmacies. Not one was located in the Peel region, in Mississauga or Brampton, communities that are some of the worst hit by COVID-19. What the NDP would be doing, I would tell you, with Brampton specifically, we would be immediately investing in our broken healthcare system. Now, let's keep this in mind. The Conservative government had 3 years to make some sort of investment into Brampton. They did nothing over the past 3 years. They knew that there's a healthcare crisis. Brampton is ground zero for hallway medicine. Thousands of people are treated in the hallways. They did not act. Now, a year before the election, the Premier, Doug Ford, comes into Brampton and makes an empty promise. And like, just to really reiterate this point, I'm reading directly from a CBC article that says, with respect to this hospital, quote-unquote hospital coming to Brampton, but details in the budget itself are sparse and include no reference to a dollar figure for the project or a proposed timeline or a description of services that will be offered as part of the expansion. It is not just me who is saying this. I really want to reinforce this idea. A variety, that's just one CBC news agency saying it. There's a variety of news agencies, a variety of folks are laying this very valid criticism, because we say, show me in the budget where there's money towards Brampton. There is no money towards our healthcare at a time of crisis. So the NDP would be committing right now to make sure that communities that are hotspots are prioritized for vaccinations. We'd be investing in our healthcare system right now. That means investing in Brampton Civic, which is underfunded. That means converting Peel Memorial from a health center into a hospital and building a third hospital in Brampton, along with making sure that people are getting the supports they need at a time where they need it the most.
Now, how would you want to respond to Gurratan and Stephen?
Always, here's the thing, right? Whenever there is a budget that comes out, and if you want to go ahead and build something, an infrastructure cost, how would you know the cost right out there, right? It takes time when you want to build something, without even you cannot just say, okay, without even knowing the actual cost, you're going to say, okay, I'm going to put $10 billion in this hospital. That's the difference between the progressive conservatives and the liberal and NDP. They just want to throw money out there without even looking at the actual cost, and there is a process that
so if I've understood correctly, I'm interrupting you. So you're saying that in the budget, your government has shown the intent to build a hospital in Brampton, but the money has not been allocated or set aside yet.
But because the reason is you have to look at the things first, right?
So then Gurratan is right. What he's saying is that in the budget, as CBC and other news agencies are saying, that budget has the line, but is missing the meat.
Right? There's a commitment to build a hospital, and we're going to, that's the reason why it's in the budget, that the money is going to be allocated. Let's just first go through the process. You cannot build a hospital in one day. I don't know if my good friends can do that. I don't know, but nobody can build a hospital in one day.
But people are going by the headline that we're bringing hospital to Brampton, and people are now waiting, when this hospital is going to come? When Gurratan and these people, they talk about it, they say there is no money set aside, and there's a word of might being used.
No.
Would there be a hospital?
There is a commitment for a hospital in Brampton.
Good. So it looks like this has become more of a Brampton hospital debate. In the last 2 minutes, Gurratan and Stephen, I would like to say, is there anything else you want the audience to know, especially when it comes to handling the pandemic, wave 3, numbers are going up. What are some of the things you're hearing from your people, and how shall we address all of these things?
I just want to add in one point, Ovais ji, that we actually heard Kaleed ji admit the fact that there's no money in the budget. And that's what we've been saying this whole time. And the government is actually misleading Bramptonians, because they came out, they created this confusion. They came out and said, we are building a new hospital in Brampton. That was an announcement that they made. But we in the opposition and Bramptonians looked at the facts and said, this is misleading because there's actually no facts that back up this claim. That's not an appropriate thing to be doing. We shouldn't be playing politics with things like healthcare, especially in a community that has a healthcare crisis. And this is a crisis that, quite frankly, when Kaleed ji says, we're announcing it, well, frankly, in 2017, the Liberals made the same empty promise for Brampton, and nothing happened there either. So we often say, Liberals, Tories, same old story. That's what we're seeing right now. We're seeing Brampton being, once again, victim to empty promises by a healthcare crisis that was created by the Liberals, and that is going from bad to worse under the Conservatives. So this is, once again, Brampton suffering, Brampton not getting the support we need. And we are demanding very clearly from the NDP immediate action right now. And what that looks like is, and I'll explain something to Kaleed ji, and I have a lot of respect for Kaleed ji, but we disagree on this point, because Brampton Civic, our only hospital, is operating at 100% overcapacity. Peel Memorial, the health center there, in Brampton was operating something like 500% over capacity, something around those lines. Don't quote me on that specifically, but way over capacity. If the Conservative government was serious, because he's saying, it takes a long time, and we agree it takes a long time to invest in these or build these institutions, but show a commitment with the government by putting that money in now, shovels in the ground right now, and start immediately by funding Brampton Civic properly, by funding Peel Memorial properly. Brampton Civic is per capita underfunded with our healthcare. We have per capita some of the lowest beds in Brampton, despite the fact we're a city of over 600,000 people with the 9th largest city in Canada. There's a lot the government could do. Instead of just showing empty promises and election promises, they could have taken action. They chose not to. And instead, they politicized a hospital announcement and they turned it into a pre-campaign event as opposed to actually working to help Bramptonians. That's wrong. And we in the NDP wouldn't be doing that. We'd be fighting for Bramptonians like we are. And if we were in government, we'd be investing immediately. And when we're in government, I should say, we'll invest immediately to fix Brampton's healthcare crisis.
Thank you very much. I would like to say thanks to all of my guests here, Stephen from Liberal Party and Gurratan from NDP and Kaleed Rasheed from the Ontario, the government party, Progressive Conservatives. اسی کے ساتھ ساتھ ناظرین آپ کا بہت شکریہ آج کا شو دیکھنے کا. ہمارا مقصد یہی تھا کہ آپ تک جو ہے وہ انٹیریو کی بجٹ کی معلومات پہنچائیں, اور کلید رشید صاحب نے کہا, گررتن صاحب نے گفتگو کی, اور اسٹیون ہمارے ساتھ موجود تھے لبرل پارٹی سے. انشاءاللہ اگلے ہفتے آپ سے پھر ملاقات ہوگی. اپنا خیال رکھیے گا. السلام علیکم.
کینیڈا سرمایہ کاری کے لیے جنت. ٹورنٹو کی گنجان آبادی کے باعث اب آباد کاری دوسرے شہروں میں. اوٹوا، برامپٹن، مسیساگا، کنگسٹن اور دیگر شہر اب سرمایہ کاری اور آباد کاری کے لیے آئیڈیل. آپ کمرشل، ریزیڈینشل یا انڈسٹریل پراپرٹی خریدنے یا بیچنے کا ارادہ رکھتے ہوں تو ٹیم آف سید کو ایک دفعہ کال لازمی کیجیے. ہم آپ کو بتائیں گے کہ آپ کے سرمایہ کا صحیح استعمال کہاں ہے. لندن، ساؤتھ ایشیا، فار ایسٹ، مڈل ایسٹ، یورپ اور نارتھ امریکہ کی ریئل اسٹیٹ مارکیٹ کا 25 سالہ تجربہ رکھنے والی سید ٹیم کو کال کیجیے. 613-276-0398. سید ٹیم، کوسٹ ٹو کوسٹ ریئل اسٹیٹ ود رائل اسٹار ریئل.
This is my masjid, this is your masjid, this is our masjid. I am Kamran Rashid, President of Mississauga Muslim Community Center.
And this masjid, this house of Allah subhanahu wa ta'ala, needs your help. This masjid is a sign of Allah subhanahu wa ta'ala. We learn, we teach the love and the akhlaq of Prophet Muhammad sallallahu alayhi wa alihi wa sallam, not only for this generation, but for the coming generations as well. And so this sign of Allah, this my masjid, this your masjid, needs your help. We need 365 donors to donate $495. That is the running expense of this masjid for one day.
ہمارا اسکول کئی مہینوں تک بند رہا. اس دوران کتنا کچھ بدل گیا. کئیوں کی روزی بند ہو گئی اور ہماری گلیاں سنسان ہو گئیں. ایک دم سے فاصلے بڑھ گئے. ہمارے اسکول جو سونے پڑ گئے. کلاس میں پڑھنے کا بھی اپنا مزہ تھا. دوستوں سے ملے ہوئے بھی جیسے زمانے گزر گئے. کہیں یہ بولتے ہاتھ اپنی زبان نہ بھول جائیں. دل میں یہ ایک ڈر سا بیٹھ گیا. واقعی کتنا کچھ بدل گیا. لاک ڈاؤن اور SOP جیسے نئے الفاظ سیکھ گئے. گھر میں سب مل کر پڑھنے جو لگ گئے. اسکول نہ جا سکے تو اسکول گھر آ گیا. اسی بہانے لیپ ٹاپ بھی تو چلانا سیکھ گئے. ان بدلتے حالات میں بھی کچھ نہ بدلا تو وہ ہے ڈیف ریچ کا ساتھ.